in this episode, we're going to be talking about 4 ways a brokenness narrative can be causing your persistent pain. Now, something that not many people know about me is that I was a very temperamental kid. I would throw temper tantrums and cry and scream for hours as a kid. And I've always been a little bit of a rebel. And so I got into a lot of trouble as a kid, and even my neighbors growing up took notice. The boys who lived next door nicknamed me Bad Liss. And I don't know, I was probably like 3 or 4 at the time, but they started calling me Bad Liss. And even though they did it in good fun to try to make light of my unpleasant demeanor, the thing is, the more that you're told that you're bad, the more you believe it. And every time I did something wrong or, fought with my sister, it was just more evidence supporting what I learned to believe about myself, that I was bad. Now, I'm not telling you the story to get your sympathy or, share how I overcame my childhood issues, but rather because this story demonstrates how when something is told to you, about you, it can affect how you act, how you behave, what you believe, and your identity. In fact, this exact thing happens when we have pain, when we have chronic physical pain. And in fact, what we're told about our bodies can actually change our very physiology, which is what I really want to get into talking about today. Okay, we are all given all sorts of messages about our bodies from our healthcare providers. And over the years in my experience, clients and patients have told me all the time about the things that their providers have said, and some of those things are quite shocking. For example, I can remember this one patient, and she was maybe like 19 or 20 years old, and she had been experiencing back pain for a couple of years already by the time I met her. And she mentioned that she'd previously been to a chiropractor who told her that her spine was off by about 1 inch in each direction. That's what she said. And that her spine was quote unquote crumpled. Okay. And of course, I was concerned, because if her spine was truly off by 1 inch, that would be pretty concerning. So I asked her, before we start any treatment, if she could bring in a copy of her x-rays from that chiropractor. So at her next visit, she was able to bring those in and we looked at them together. And let me tell you, while I may not be a radiologist, I was trained in how to read a lumbar x-ray. I'm telling you, this was the most beautiful spine x-ray. It was certainly not off by 1 inch in each direction, let alone a millimeter. And it certainly wasn't crumpled, as this chiropractor had told her. This x-ray could have been the textbook example of what a healthy spine should look like. And why this chiropractor told her these things about her spine is totally beyond me, but his words affected her deeply. This young woman would have to wake up every morning in fear that she would become paralyzed at any instant. As a young woman, she began to change her behaviors, the way that she moved, and what activities she participated in because of those words. And she began to feel helpless and anxious and hopeless and fragile because of those words. I had another client who had recurring episodes of back pain for years, for probably decades, and been searching for an explanation as to what was going on for years. And the only thing the doctors could ever say was, oh, you have a bad back. You're in your 60s, so what do you expect? You have a bad back. You need to start watching what you do because you have a bad back. And those words really created a lot of fear. They described it as they felt totally unclear of exactly what it meant to have a bad back. It created this sense of uncertainty because, if you don't really know exactly what's going on, you don't know what's safe and what's not safe. But you do know that you have a bad back, so everything is unsafe at this point. And it changed their behaviors, it changed their actions. They stopped going on walks and they stopped going on hikes. They stopped working out and squatting and bending and lifting. Because again, like I said, when you don't know what's going on in your body, you go into this full-on protection mode, right? Being told that you have a bad back had really changed their actions, their behaviors, their beliefs. And having a bad back even became a part of their identity. You see, many people with this ongoing type of pain end up feeling like damaged goods. And this is what I call the brokenness narrative. These are the things that we're told about our bodies, about our pain, the language that we use. And it changes our behaviors, our actions, our beliefs about ourselves, and it impacts our identity, okay? This is what I call the brokenness narrative. And in my experience with speaking to people in pain, this is something that I see all the time, where people view their bodies as broken or damaged goods. Now, most of the time, these brokenness narratives don't come from ourselves. Most of the time, we don't develop these brokenness narratives on our own. Most of the time, they come from our healthcare providers. They're given to us. These are things that are said about us. They're things that our healthcare providers say to you about you and your body. Just like the nickname Bad Liss shaped my behavior and my identity, where I started to believe that I was inherently bad as a kid, being told that you have a bad back can do the same thing. Now, I'm going to give you several examples of things that healthcare providers have actually said frequently, that commonly say, that have created these brokenness narratives in my clients and my patients over the years. Okay. And in my, nearly 13 years of talking to people with pain over and over and over, these are the things that people tell me that they've been told. And I'm going to share some of these common examples. But what I want you to think about as I tell you these examples is I want you to reflect on your own experience and think about what you've been told by your physicians, by your physical therapists, your chiropractors, and your massage therapists, And I really want you to think about how each of these examples could create a sense of fear. And I want you to think about the mental image that each of these phrases creates. And think about how each phrase might impact your actions, your behaviors, your beliefs, and even your identity, okay? So some of the things that providers say, they tell you your hips are out, or your hips are off, or your spine is out of alignment, right? Oh, it's out, where did it go, right? They say your core is weak, or your glutes are weak. You'll hear that especially from your physical therapist. Or how about this one? You're bone on bone, right? How terrifying. Immediately imagine the jarring and the grinding and how, any movement must be damaging if you're bone on bone, okay? Your muscles are like rocks, These are the worst muscles I've ever felt. Maybe you might have heard that from a massage therapist or a physio. And you gotta love this one. Oh, you have the spine of an 80-year-old. I can't tell you how many times I've heard that from 30-year-olds who've been told by doctors that you have the spine of an 80-year-old. And I mean, you could just imagine the mental image that creates, right? We already talked about this. You have a bad back, you have bad knees, right? Again, whatever that means, right? What does it mean to have bad back? This one I hear all the time. Your ribs are out, your shoulder is out, something is out of place. Terrifying, right? Same thing, your discs are slipped, as if they're like these hamburger patties slipping out of the bun, You have hypermobility, and it's just a wonder that you're not paralyzed. I mean, straight up fear mongering. That's what that is. You'll have to give up running, or you'll never run again. Yep. Give up everything you love. Everything you love and enjoy doing, you'll have to give it up. You'll eventually be in a wheelchair. Just manifesting your future self, right? It's inevitable. You're going to be in a wheelchair. Or this like putting restrictions on certain movements, no bending, no lifting, no twisting. Ultimately, no movement is safe for an unlimited amount of time with no definition of how much weight you can't lift. Or they're just preaching acceptance, right? You better learn to live with it. This is just your new normal, and there's nothing more that you can do. There's nothing more we can do. Now, listening to this list, it's possible that you've been told something like this before yourself. You could probably add a handful of other things to that list, things that you've been told from your healthcare providers. But can you see how those phrases, how this kind of language can really create this sort of brokenness narrative? And it's important to note here that what your providers don't say can be just as harmful as the words that are said. So for example, maybe you have pain but you don't have a significant injury. Maybe your test cell came back normal and the doctors tell you that nothing is wrong with you. And they imply that the pain is all in your head. This can create this same sense of fear because, like I said earlier, if you don't know what's wrong with you, how do you know what's safe and what's not safe? You'll have to protect yourself from anything and everything because you don't know what's safe. So you have to change your behaviors, change your activities, the way that you move, right? It really ramps up the fear, this sense of uncertainty. And the brokenness narrative shows up here as you think, things like, well, if none of the doctors can figure out what's wrong with me, then it must be really bad. Maybe they're missing something. Either they've missed something, or maybe I'm really crazy. Maybe it really is all in my head. And so you start to question yourself. When healthcare providers tell you things like your core is weak, your spine is out of alignment, it can have several negative impacts, and it can actually hinder your ability to recover and make things worse and make your pain worse. Okay, and so I'm going to share 4 ways in which having this brokenness narrative can hinder your recovery. Okay, so number 1, when we adopt these brokenness narratives as our own, it leads to these feelings of helplessness, right? It creates a sense of hopelessness, like nothing cannot be done about it. If you're told that you have a bad back or you're bone on bone, it's like, well, what can you do? It just sounds like something that you'll just have to live with now from now on. You better just accept this as your new normal, right? That then impacts not only your outlook, but your behaviors, right? It can lead to inaction where there's this sort of reliance on passive remedies like wearing a brace all the time or using pain patches and creams. And it can cause you to rely on quick fixes that relieve the pain, offering short-term relief, but nothing long-term, like going for injections every 3 to 6 months or getting massages every other week just to get by, just to manage that pain. Because again, there's really nothing else you can do if you just have a bad back or you have bone on bone arthritis, right? There's not much else you can do. It gives you this hopelessness, and it can lead you to give up on seeking those proactive interventions. And again, like I said, relying on symptom solutions rather than addressing the underlying cause. And you think about it, it's because you believe that there's nothing you can do about the underlying cause, right? Now, number 2, the brokenness narrative is dangerous also because it can lead to this sort of victim mentality where the belief that I am broken becomes a part of your identity. You tell yourself, I am weak, I am frail, I am disabled. And this victimhood becomes a part of who you are, which makes it even harder to heal. When it becomes a part of your identity, it is even harder to separate from. And what's worse is that at the same time, you feel like you're broken or damaged goods. Deep down, you have a different identity, right? You're still that active mom who loves hiking and gardening, who loves traveling and, being silly and spontaneous and going out dancing with her friends. So what happens is there's this internal conflict that happens. And it creates this internal tension between your true identity and this brokenness identity. And that tension between the two sort of creates this internal turmoil. It starts to eat away at you and impact your mental health and your self-esteem. This is one reason why so many people with pain struggle with anxiety and irritability and depression and mood swings. We talk about that all the time. It's not your fault. And we know that anxiety and depression can also make pain worse, right? It is an endless toxic cycle, right? So number 3, these brokenness narratives force us to put the focus, all of the focus, on the physical aspects of pain, right? So for example, if you're told that your core is weak or your spine is out of alignment, you get very focused on trying to fix those physical issues, right? Those are very mechanical and structural issues. And so you think, well, I can't fix my pain if I don't strengthen my core or correct my alignment. And I see this happen where people, will work on their core for years in physical therapy and no relief. Like the problem wasn't your core, right? It wasn't weak to begin with, but I digress. But what ends up happening is that many people end up reaching a plateau with their physical remedies, right? Many people reach a plateau with their physical therapy, and oftentimes surgery, either it isn't an option or it isn't a desirable option. So, you can quickly reach a dead end with the physical remedies, and that's when folks end up saying things like, well, there's nothing else we can do. There's nothing else I can do. But this focusing too much on the physical problems and solutions leads us to leave other aspects of pain overlooked and unaddressed. Okay, so yes, there is a physical component to your pain, 100%. But pain is incredibly complex, and it involves both the physical body and your nervous system. So the reality is, and the good news is, there are other layers of pain that can be addressed as well, aside from just the physical, especially your sensitive nervous system. Even if there's truly nothing else that can be done from a physical standpoint. Now, lastly, number 4, when we adopt these brokenness narratives as our own, it actually triggers the nervous system to change its physiology. It ramps up its protect and defend mechanisms to protect vulnerable areas, resulting in, ultimately, greater pain intensity and more sensitivity. So these brokenness narratives, they create these negative mental images of the painful region. For example, after I injured my shoulder, I was told that my shoulder was so loose that it would just slip out of place, and it would, and the bone would just like bump into the big bundle of nerves that runs down the arm, and it would cause a dead arm. My arm would go limp. And I had this mental image that my shoulder was extremely fragile, that the cartilage in my shoulder was really thin and frayed, and that my muscles and my tendons were like these like thin strands of frayed ropes. And so in my mind, there wasn't a whole lot holding it all together, right? So I had this mental image of a very fragile, unstable shoulder, very at risk for injury. It was very vulnerable. And without me even knowing it, it affected my behavior. It affected my movement. So it wasn't actually until 6 years after the injury itself, even long after I stopped having daily pain, I realized that I didn't swing my arm when I walked. Okay, so this mental image had changed the way I move subconsciously, right? I was keeping my arm close to my side, effectively immobilized and protected, trying to keep it safe from re-injury. And still to this day, I don't swing my arm when I walk. And this happened all entirely subconsciously. It wasn't something that I told myself that I needed to do or started doing on purpose. It became a compensatory, protective movement pattern to protect what I believed was a fragile shoulder. And all of this, like, again, I'm saying this, like, I believed it was a fragile shoulder, but like this was happening subconsciously. But these mental images don't just cause protective compensatory movement patterns, they actually cause deeper protective changes in the nervous system as well. So think about it, if I have this mental image of an incredibly frail, frayed, and fragile shoulder, how do you think my body is going to respond to that? That shoulder is not safe, right? It's vulnerable. And my body and my nervous system is going to make sure that it does everything in its power to protect that area. So it's going to increase the sensitivity of my nerves in that area because it wants to know if something is at risk for injury. So it wants to be better at detecting mechanical and physical stimulus, okay? So now the nerves, they actually change their physiology. They change their sensors so that it's easier for those nerves to detect movement, stretch, mechanical pressure, inflammation, changes in temperature, right? Making them more reactive so that they can start firing and sending danger messages with smaller stimuli that's often not normally painful. Okay, so you end up feeling more pain more often and more intense pain. And that nervous system is also going to increase my muscle tone, my muscle tension in that area to attempt to keep the shoulder stable and immobilize it and protect it from injury or re-injury. And it's going to also increase inflammation in that area to attempt to heal any potential damage. And these changes that happen locally lead to a cascade of other changes upstream in the nervous system, in the spinal cord and in the brain. And the worst part is these nervous system changes can cause you to feel pain long after that injury heals. It can cause pain disproportionate to the degree of injury or damage. Now, we know this is at the root of chronic pain. This is why the brokenness narrative and the messages that we get from our healthcare providers are so harmful, because they can send your nervous system into high alert mode, leading to even more pain and stiffness and tension. What your providers say is vital, and it can be, I mean, just think about it. The difference between a provider who initially says to somebody, yes, you have, let's say, a torn labrum. Yes, you have a torn labrum, but this is something that can heal with time. Versus, yeah, you have a torn labrum and you're going to be in pain for the rest of your life, right? Like, there is a difference between that narrative. Okay, so to review, adopting a brokenness narrative can, number one, lead to hopelessness and helplessness and a reliance on these passive remedies and quick fixes rather than getting to the root cause. Number two, it can impact your identity. It impacts your thoughts, your behaviors, your actions, your beliefs about yourself, leading to inner turmoil, putting you in a debilitating cycle of anxiety, depression, and pain. Number three, it causes us to focus on physical remedies, and other aspects of pain, such as the nervous system, remain overlooked and unaddressed. And number four, it causes a full-blown protective response, both within our movements and deeper within the entire nervous system, increasing nerve sensitivity, muscle tension, inflammation, and a cascade of other changes in the nervous system, all leading up to more pain and physical discomfort. Okay, so I hope that you can see just how harmful these brokenness narratives can be and how they can truly cause persistent pain, make your pain worse. The truth is, and this is not just me, trying to be overly positive or be a cheerleader for you. This is coming from my years of experience, both as a board certified orthopedic doctor of physical therapy and as a chronic pain specialist. The truth is that having intense pain doesn't mean you're hopelessly broken. There's a deep need to shift from this brokenness narrative to one of potential healing. Okay, you're not just broken with weak or bad joints, and you're not destined to have a life defined by pain. Okay, you do have the potential for healing by shifting the narrative and the focus to include the underlying hidden aspects contributing to pain. The first step to shifting this brokenness narrative is to recognize the role that it's playing in your story. So start by asking yourself, what messages have you been told by your providers, by those close to you, and the messages that you've been telling to yourself? Think about the language that you use to describe your condition in your body. Start by recognizing that language, and then recognize the deeper impact that those phrases might have on you, right? How might that language impact the way that you move? What mental image does it create? How might it change your behaviors and your actions? The types of interventions that you seek. Does it create a sense of fear, a sense of hopelessness and helplessness? Does it create a need for protection? Does it create tension and inner turmoil within your identity? Once you recognize it, you can start to question it, right? Question its validity, which no doubt in certain circumstances may be incredibly hard to do, right? Even that young woman who was told that her spine was crumpled never completely parted with that narrative, even after we looked at her perfectly healthy x-rays together. But she was able to start writing a new narrative for herself, telling herself a new story, one where she wasn't broken or damaged goods, where she wasn't as fragile as she had previously believed. She was safe to move and live her life. And gradually she was able to go back to her regular activities without fear. And rather than looking for evidence supporting the belief that she was broken and that her spine was crumpled, she started looking for evidence that her spine was healthy and strong and resilient and capable of healing. Shifting this narrative is hard and it takes time, but it starts with having that awareness, right? So when you get out of your own way in this way, you stop focusing on the physical aspects of pain, you stop compensating and limiting your movements and activities, you also open yourself up to addressing the other aspects of pain. So I encourage you to seek comprehensive pain care that includes nervous system retraining. Because again, even if you can't fully address the physical problems, the structural and mechanical stuff contributing to your pain, you can unlock additional pain relief by addressing the role the nervous system plays in amplifying pain, which opens the doors to relief that you never thought possible. And of course, this is the focus of my program, the Chronic Pain Breakup Method, which has helped hundreds regain their quality of life and become as pain-free as possible. And if you know that having all the steps laid out for you so there's no more guesswork with expert guidance along the way, if you know that that'll get you there faster, then take that first step and just set up a call with me to chat about your specific case. Now, I hope you found this episode helpful, maybe a little bit eye-opening. And if you did, I'd love it if you would share your experiences and your thoughts in the comments. So let us know what you've been told by your providers and how those messages have shaped your brokenness narrative. I want to say thank you for tuning in. As always, remember to subscribe, leave a review, and be sure to follow me on social media. On Instagram, I'm at Pain Crusader, and I'd love to connect with you over there on the good old IG. And remember, you're not broken. You have the potential for healing and a life with less pain.